Good morning, good morning. I'm Dr. Dale Dangleben, and on behalf of Patient Choice and Chemin, Neuf, Pointe, Michel, this is your daily medical tidbit. Before I go in to start my shift, I'm putting out this video, and it's another year around the sun for me. I want to talk about cervical cancer because it remains a persistent threat to Black women. And it was once the leading cause of death, by the way, but it has become largely preventable. Screening and vaccination is important, but Black women continue to experience higher rates of both the diagnosis and the mortality, right? And this kind of disparity reflects not just biology, but we have to look at the painful, inequality, access, and systemic neglect of Black women. And that demands urgent attention. And us, Black folks in the medical field, should not bury our heads in the sand and speak up on it. And women must advocate. Okay? Well, not just women, everyone should advocate. So cervical cancer develops in the cells of the cervix, which is the lower part of your uterus. I will get a little more into uterine and endometrial at a different time, different talk, and that connects to your vagina, right? Mostly all cases of cervical cancer is linked to high-risk strains of HPV, which is the human papillomavirus, right? Which is a very common sexually transmitted disease. All right, and we have to take that in mind because HPV chronic infection is precancerous, right? And those changes will lead to cancer, right, if left untreated. So routine pap smear and HPV testing, is important, and it can detect these early changes, all right, allowing for early treatment. The HPV vaccine, is another powerful preventative tool, and I want to dedicate a whole lecture on that tomorrow, all right? So I'll get into that in more detail in terms of the vaccine. But it's a powerful preventative tool protecting against the most dangerous viral strains before exposure ever occurs. So keep that in mind. But the question that we must ask is, why are Black women are disproportionately affected, right? Despite all these advances in medicine, the burden of cervical cancer remains heavier for Black women, and that is multifactorial. Okay, limited access to preventive care, right? In many communities, especially those that are under-resourced, right? Regular gyne exam and screenings are not consistently available or affordable, right? And Black women are statistically more likely to live in areas with fewer healthcare providers, less access to insurance, all right? And that leads to both delay in screening and treatment. Also, late-stage diagnosis. When cervical cancer is diagnosed in Black women, it's often at a more advanced stage, right? And when you advance, you have fewer options for treatment, and your outcomes are poorer, right? This is not due to genetics or biology, but barriers, right? Fear. Black women have a genuine fear, a mistrust of the system, right? And systemic failures. These are important things that we have to educate on, and we have to overcome this barrier. We must talk about the implicit bias in healthcare, right? Studies show that Black women are less likely to receive guideline-based care after an abnormal pap test. They're also more likely to experience dismissive or delayed response to symptoms like abnormal bleeding or pelvic pain. And that contributes to what? Late diagnosis and higher mortality. The HPV vaccine I'll get into more tomorrow, but there's gaps in there. Significantly reduced cervical cancer in young generation. Vaccination rates among Black adolescents remain very low, and we'll get into that. Okay? So I just wanted to put that out there on cervical cancer and breaking that cycle. reducing cervical cancer burden among Black women. And that requires, intentional actions at multiple levels, right? We need access. We need to be honest. We need good education. We need to promote the awareness especially about HPV. We need to talk about early warning signs. We need to have pap smears available, okay? And we need to start building trust, culturally competent care system that respects and empower our Black women, okay? So this is my call to action, because cervical cancer is preventable, right? Yet too many Black women continue to die from a disease that modern medicine knows how to stop. All right? So I just wanted to put that out there. So we get out there, we champion the cause. It's one thing to walk, it's one thing to wear a ribbon, it's one thing to wear a shirt. But we need screening, we need vaccinations, we need surgical capabilities, and all what needs to be done to make this manageable. I'm Dr. Dangleben. Have a great day. Peace.